Welcome everyone. This is Dr. Jaitly from New York, your cardiologist on your favorite website, MuniMeterHealth.com, which is dedicated to educating you about the human heart and its illnesses. And essentially, we are on two social media video channels, as you know, and hope you're watching on either of them or both of them. So without any further ado, I'd like to delve into the subject matter. And of course, first a few housekeeping rules here. One, this is not a replacement to your text. It's a supplement to your text. Please note, all my students, residents, and dear fellows. And two, this is an educational tool. It's not a treatment advice tool. So just be aware of that as well. Now, without any further ado, to delve into the subject matter. The matter of the subject here today is we're going to calculate the cardiac output, which we'll call it CO, by nuclear scan. And nuclear scan, when we say, it's a gated blood pool scan. Okay, so it's also called MUGA, but now today we have, even while you're doing the SPECT scanning, like for ischemia, you can actually just attach your EKG and have the gated blood pool program into it, and automatically it'll measure the volumes of the various chambers that you want to analyze. So looking at quickly what the left ventricle will look like in diastole. Here is your diastole. And the contents of the valve of the left ventricle are shown here in the red, and that becomes your volume. And again, the program actually calculates for you, but basically what you're doing is you're recording it in end-systolic, so we call it left ventricular end-diastolic volume. And then in left ventricular end-systolic volume, we're going to show a smaller ventricle, and we can show again in the same fashion. Here is a smaller ventricle, and this is your, obviously the muscle wall is a little thicker because it's contracted, and then you have the volume here inside, and this becomes your left ventricular end-systolic volume. Okay, so subtract LVESV from LVEDV, you'll get the stroke volume. So stroke volume is LVEDV, which is end-diastolic volume, minus the LVESV. That's it. So stroke volume, say, so LVEDV normally when end-diastole, obviously the ventricle is fully filled, that may have a capacity of 150 ml, say, for theoretical reasons. And when it's totally contracted and send the blood up into the aorta, and this is your stroke volume per beat that's going out. Say the volume here in the ventricle that's remaining residual is, say, 75 ml. Okay, so what is your stroke volume? Your stroke volume is 150 minus 75, which is roughly about 75 ml, and that's normal. 75 to 80 ml is normal, and times the heart rate will give you the cardiac output. As simple as that. So stroke volume times heart rate is cardiac output here, right there. Okay, so in a nutshell, you've learned to calculate, by gated blood pool mechanisms as to how the stroke volume can be calculated, and therefore the cardiac output in a setting where you have a gated blood pool program attached to the cameras, which are actually recording all the gamma particles, which are being measured in a volumetric way. And they are measured in terms of ml, and LVEDV is in ml, LVESV is in ml, stroke volume is also in ml, and that times the heart rate gives you the liters per minute of your cardiac output. Okay, as simple as that. So thank you again for watching MuniMeterHealth.com. This is Dr. Jaitly. See you again.